Gavin Crump, plants versus pills.
Sue Crump.
Wesley Crump.
Okay. Hello, everybody. I want to talk to you today about the incredible potential of one plant in particular. You may know it as Mary Jane, and I know it has some negative connotation, but I hope to leave here with a little knowledge on your head of this naturally occurring treat of a plant that our planet Earth provides for us. I want to try to open your mind a bit, expand your thinking, like especially when it comes to pills, when you try to cure one thing with one pill and you get a side effect from that one pill, and then you get another pill to try to cure that side effect. You know, you're dealing with a lot of different medications, and cannabis has been a discussion for centuries. I mean, our ancestors have used it. We know this. People have recognized its therapeutic properties, and now science is beginning to finally catch up. Like around 2025, I'd say not all states have even fully legalized it, so they're still catching up. But yeah, I feel like it can cure a lot of things that doctors prescribe people pills for, and those pills make side effects, and nobody likes side effects. Everybody's had side effects from medicine. I mean, to name a few, you get diarrhea, constipation, whatever, and everybody is different. And this one plant can make all those medications like just go away, basically. So, besides that, it's low cost because we can grow it very easily it's naturally provided, just the legal standpoint is the only thing that I think is what we're looking at right now. But besides that, if we could ever have a crossroads with the pharmacy industry and the cannabis industry, everybody would be able to get a little bit better help. Excuse me. If you think about it, it's a natural source offering relief for conditions that often require strong pharmaceuticals, like I said, with potential side effects. Here's some research looking at specific components of cannabis. For instance, a study published in 2019 in the Permanente Journal by Shannon, Lewis, Lee, and Hughes, titled Cannabidiol and Anxiety and Sleep, a large case series, investigated the effects of CBD, which is a non-psychoactive part of the cannabis plant. The study looked at a number of cases where individuals used CBD for anxiety and sleep issues. Basically, the findings suggested that CBD may offer an aid in helping anxiety and sleep, people that have trouble in those departments. Well, another piece that's significant comes from 2021 study published called I mean, excuse me. A piece of research comes from 2021, a study published in the journal Pain Medicine. The researchers, Lucas Walsh, Crosby, Calloway, Bell, Al, Cale, Hughes, and Wilkinson, conducted a study titled Substituting Cannabis for Opioids in Chronic Pain Management, a cross-sectional study of 2,114 patients registered in the Canadian National Medical Cannabis Registry. This research looked at a large group of over 2,000 people in Canada that were using cannabis medically, and they found out that a lot of these people were doing it to manage chronic pain, and it suggested it might be a viable alternative for individuals seeking, pain relief, rather than taking pills and maybe getting addicted, and this, that, the other. You could just use cannabis. And research supports this idea. For example, a study published in 2017 in the Journal of Pain Research by authors Raymond, Welty, and Anderson with the title Cannabis as a Substitute for Opioid-Based Pain Medication. Patient self-report outcomes from a survey of 2,737 medical cannabis patients in the U.S. found some interesting results. The study looked at a large group of people and replaced their opioid-based pain medications, basically. They often said that they preferred the cannabis because it had fewer side effects, and they just had a better overall quality of life. I mean, without those pills in the way, the whole opioid crisis and all that, the pills just aren't good in general. Especially nowadays when you don't know what's in them, because you can just get anything off the street and you think you know what it is, and it's not. And I want to be clear, I'm not suggesting we abandon modern medicine altogether, because it's brought incredible advancements, especially in treating disorders like treating disorders such as multiple personality disorder, schizophrenia, stuff like that. Cannabis can't just cure stuff like that. We still need medication for that. So I'm not just trying to abandon medication. I'd just like to, have it looked into more and be looked more at as a medication than a drug, because it's not. And imagine how many medications will be off the market or not have to be taken at all. A future where we harness the power of plants, and with more research, there's no telling what other types of stuff that could happen. I mean, look what we've already done in 2025. And it's only 2025. I mean, we've already made so many advancements, but marijuana is only legal in so many states. So I mean, you know, we're still getting there. And I have a little bit of personal knowledge. I work at a farm in Louisiana. But I would like to set a lot of safety measures in place, you know, to avoid all of that. But I feel like it could get a lot of that medication that we don't need off the market and just have it replaced with one thing that everybody can afford, and you don't need insurance for. I believe a partnership between traditional plant knowledge and modern scientific understanding, like by embracing the knowledge that we have of the plants, and then collaborating together, we can unlock so much, you know. I mean, it's full of potential. I like to call it the green pharmacy. we can move towards a healthcare that's more holistic and more personalized and less reliant on medication that comes with a long list of unwanted side effects that nobody likes. Let's open our minds to the wisdom of the natural world. Let's explore the incredible potential that lies within the plant kingdom. The journey may be complex, but the promise of a healthier, more balanced future is certainly worth exploring. I'd like to thank you. Say your name. Say your name. Say your name.
Oh, Sue Crump. I'm sorry.
Wesley Crump.